In the interest of time, let's get started. Thank you for sharing your afternoon with us. I'm your host, Jacqueline Davis. I work at Calian in the IT and Cyber Solutions division. Just a quick little bit about what Calian does. Calian's been around for 40 years. We play in the mission critical space for IT and cyber, and we support organizations like healthcare, so the folks that are on the call today, and also places like NATO. Today we have a great panelist and we have a great host. His name is Noel Trinidad from Calian, and I'm going to turn over this webinar to him now for him to introduce our panelists for this discussion today. Enjoy your webinar.
Thank you, Jacqueline. Much appreciated. My name is Noel. I lead the GTM, the go-to-market for data, AI, and modernization. Simply told, my job is to work with customers to deliver incremental value to their business. But today with me, I have a very powerful panel, and I've learned so much with them in the last few weeks of, working with them. And I'm really excited they're here. They have deep healthcare experience. We'll start with Mustafa, and then Colin, you can go next. So please introduce yourselves.
Thank you, Noel. Mustafa Eldora. I'm a principal product manager with our healthcare and life sciences engineering team here at Microsoft, based out of Toronto. Very happy to be on the call, working with you, Noel. Calian has been a great partner to Microsoft in the healthcare space and beyond. I'm super excited about our session today.
Welcome, Mustafa. Over to you, Colin.
Yeah, good afternoon, everybody. It's great to be here. Normally, I am based in Toronto, but as you can see, I'm actually here in Nashville attending a conference. But I am very excited. I am a professional conference goer, aka an editor at a publication called Healthcare IT Today, where I have the good fortune of covering everything digital health, EHR, interoperability, AI, all of those kinds of things. So very excited to be here. I've learned a lot, and looking forward to today.
Thank you, Colin. A little bit about me. I've spent a career advising and being a client on major transformations, right from automation to ERP to electronic health records and cloud. I've seen the buyer and the user as I've tried to help employees adopt into technology. We're going to speak a lot about it today. What excites me most about this current era is if internet gave access of information to people worldwide, data and AI is going to take it to a different level, from democratizing intelligence, and it's going to create unprecedented opportunities. That excites me the most. I think from a buyer as well as from a user perspective, there are some really good things that are going to happen as we look into what is the potential of this. So moving on to what we did in preparation for this webinar, first thing we did was looked at your ecosystem. As you can see from here, it's very intricate but connected, which poses a lot of challenges, and we understand why those challenges need to be talked about, analyzed and given a fulfillment. We, as part of this ecosystem look, obviously these other ancillary parts to the ecosystem can also be supported in terms of data and AI. But this is where your map looks like. I'm sure you have seen it a lot of times, but to get down deeper though, we focused more on medical and surgical hospitals. And we'll tell you what we did as part of it. We took a bit of the pill ourselves. Moving on, we wanted to use data and AI to see what was some of your unique needs. We wanted to make sure that we were getting a deeper dive into your business priorities and digital trends. And we were looking for some unique end-to-end solutions, and you'll see some custom solutions that we're gonna demo today, based on how we see, success for transformation in its real world. So talking of intelligence, we looked through the 10Ks, annual statements, quarterly reports, and made sure that there was a strong understanding of your needs. Now, Calian has a heritage in healthcare, as Jacqueline pointed out. We've spent 40 years in the business, and we have a deep understanding from a data perspective, from a modernization perspective, from a NOC and SOC perspective. So there's a lot of expertise that we bring to the table. Now, based on this particular analysis, where we arrived was 6 different themes emerged. And as we looked at these themes, I want to have a quick word here, Mustafa, from you in terms of data-driven and the reality and challenges of data-driven patient care.
Thank you, Noel. I think one of probably the most modern lenses look into the problem statement here. Traditionally, data-driven for patient care was, I don't want to say the word limited, but it was very focused on electronic health record systems. Today, with the advent of the cloud computing, modern IT infrastructures, very modern EHR as well, you will see in the marketplace, and also the complementary data sources being also modernized, in many cases on many data standards that are being even more adopted in the industry. So today, just looking at the electronic health record systems, it's still as valuable as it used to be, but there is more added value that we see often. Healthcare organizations, from providers to pharma and R&D organizations, they really try to complete the 360 view of that patient. And if you look at the patient data footprint throughout their journey, yes, EHR captures the most of it, but then you also get to see there is radiology and medical imaging that being, very much available to these organizations, but very less diagnosed or analyzed so far. You look into the new trends into digital pathology, and this is a whole new era where you're going to have access to data sets always existed somewhere in a native form, but not in a digital form. And then you add the medical devices and the stream of medical information you receive from those devices, let alone the genomics and the manifestation of that into the clinical and bioscience research. So putting all that together to the research and to the science to build that fully comprehensive data profile of the patient, I think this is something super exciting, and we are going into an era we've never been into before.
Yeah, the maze of data has always been fascinating on account of the intricacies of various networks that are engaged. But I see personalized care coming through, Colin. What are your thoughts on that in terms of personalized care, and what are you hearing from hospital administrators?
Yeah, I mean, in my travels and all the CIOs and conferences we get a chance to go to, I mean, the holy grail that we're all after is the complete longitudinal record, right? Where, whether you're a hospital, my primary care provider, even a clinic that I might visit, the hope is that you would be able to access my complete view of my health record, which includes, as Mustafa said, information from the EHR, but increasingly includes information from my wearables, the ambient stuff that's monitoring me in my home, the devices that I may be using, even my car, right? And where I go and whether I'm exercising and all, having access to all that information is going to paint a more personalized picture of me as an individual, which then I hope, and everyone hopes, that the healthcare systems will then use to personalize and tune my treatments to match my exact situation, right? I mean, that's really the goal. And of course, what we're going to be talking about today is, we're pretty far from that, partly because the data is not as clean as we all like. And then even if we do have the data, it's not compatible, it's not interoperable, it cannot be shared very easily without transforming it. So, I think we all have the same vision, but in the sort of the steps between there and here is, there's a gap we have to fill.
Yeah, it's interesting because from a perspective of the healthcare system being burned on both sides of the border, Just wondering about your thoughts, Mustafa, first you, and then Colin, from a workforce solutions, how can we, make sure that, there is an ability for the workforce to adopt some of these technologies so they can get more, they can get better balance in terms of the burden?
Yeah, and I think we all been through these pains, and we've seen all the reports for the nurses burnout that happens a few years back, and this is it hits very close to heart and to home. I think one of the advantages we see in technology today, the emergence of the large language models and their applicability in dictation, for example. This is a huge uptake. There is a huge uptake in that angle. How can we take away some of the repetitive manual work that our healthcare professionals really have to go through? And is technology the right solution for that, and how? So that will improve the workflow, not really from the workflow perspective, but just from the human interaction perspective. Our nurses, our doctors are human by the end of the day. And if there is anything that we can make their experience more conducive and more enjoyable or even more efficient, I think that's a role a technology can definitely play in. And we've seen a lot of new innovation in that space, whether it's dictation or citation or even summarization of clinical notes.
Colin, your thoughts?
That's a fun question, right? Like when I think about scaling, one of the challenges I see is, scaling the people in healthcare, right? Like, yes, burnout is an issue, but I also see, IT teams are struggling in healthcare, because let's be honest, people would rather work for Mustafa's company than work in the IT department of most healthcare systems, right? Like it's not sexy to work at a healthcare system as it is to work, let's say, at a Microsoft or other tech companies. So where I see, data and AI and all this tooling being very valuable is actually helping healthcare organizations to scale them to meet the needs of IT there, right? It's using AI to become more effective and efficient at delivering the technology for care, to be able to defend better through cybersecurity enhanced with the AI, to identify threats and so forth. So, one of the areas that I'm very excited about, and I think people are generally very excited about, is how can AI actually help us do more with the people we have, or do just as much with the people we have. So part of that is to reduce burnout, but I think also part of it is just to make us more effective and efficient. And that is where I think people are very excited about the potential usage of AI.
I think obviously, I think this is a perfect segue into our next topic in terms of investments and scaling and the responsibility of even providers like ourselves and Microsoft to think about the long-term play, because you want to make sure the investment is working over a period of time and it's not death by 1,000 pilots, which we've all got used to. And, our responsibility, and morally and ethically, I feel very strongly about this, is to make sure the investment has returns over a period of time. What are you hearing, Mustafa, from hospital administrators? Are they fussing about scalability, or do they see the long play in your mind?
Yeah, I think when you think about our, Canadian healthcare system and the day-to-day challenges at the hospital space, at the provider space, there are realities when it comes to the scale of IT and the priority of IT within those organizations. Like Colin mentioned, for once, just the workforce and the attraction of IT talent for them, it's probably not the first tier in the market, but it is a very attractive tier. I do want to acknowledge that. Reality is IT for these organizations, the hospitals, the healthcare providers, the healthcare agencies, as important as it is, it's probably at the end of the supply chain, and not for wrong reasons. If I had a $1 investment, do I invest into shortening my wait times, or do I invest into a new server? I'm definitely going to invest in the new wait times. And my second $1 investment, do I hire the new nurse to expedite my triage process, or do I buy a new hard disk? You're probably going to hire a new. And I'm being very, subjective with these examples, of course, but you get the point. It's a fiscal reality we have in the Canadian system. These are taxpayers' money. You really want to prioritize them for the delivery of the care, as well as innovation and improving the infrastructure. But it's not the top one tier in your priority list or in any CIO or CTO organization. They really have to make the case for it. And the way you make the case for it, you have to show what is my ROI. If I invested in this IT technology, why is it as important as adding extra nurses or renovating my hallways and the wait times? How can we compare the value add between the logistics and the operations of the hospital versus the IT infrastructure? And one great example, I think in Ontario a couple of years back, actually before COVID, our triage system was fully modernized, and we have it in electronic form through all the Ontario hospitals, and there are multiple studies published. How did that actually help improve the quality and the reporting of triage across the entire province and across every patient we have? So reporting is really important to show the value. And because we're dealing really with patient lives and patient quality of life, the reporting, while it can be and should be quantitative, there is always the qualitative part of that report. So sometimes I'm not really shortening the wait times, but the feedbacks, the reviews, the sentiment I have with the patients have really improved. So quantitatively, you haven't really achieved much, but now you have more quality in the patient journey and the patient experience. And these are things I think is as important, if not even more important, than focusing on my query is going to run 5 seconds less or 10 seconds longer, right? So I think these are aspects in the healthcare setting that is really important for us to grasp and to make sure we speak the language that will make that decision happen.
Two things, that really, based on that conversation. One, because the dollar is finite on both sides of the border, it needs to stretch a little further in terms of, helping with solutions. And the second part, tangible outcomes that need to be reported. And over to you, Colin. What are your thoughts when it comes to scaling, and what are you hearing around this particular topic? I'm sure there's a lot of debate on it.
Well, yeah, I mean, everything that Mustafa said is definitely true, right? Scaling to meet the needs, scaling people. The big thing that I think has a lot of healthcare leaders worried is scaling to meet the needs of patients, right? Our patient demographics, the nature of patient expectations, even social economically, patients are changing. We're heading, we hear about the silver tsunami. People are living longer. They want to live at home. They don't want to be living in assisted living facilities. So, hospitals and healthcare organizations are trying to figure out, how do I scale my operations to extend beyond the walls of my physical plant? How do I get and give care in someone's home, mobile, all these kinds of things. And so this is putting a big strain and stress on healthcare infrastructure. And so I think one of the scaling aspects of healthcare that people are concerned about, but are looking for technology to help, is scaling this capability to deliver care and meeting the patients where they are, which now is more increasingly going to be at the home. So I hear a lot about that, and I hear about just scaling to meet the broadening needs, right? Of more online capabilities, more capabilities to do things on my cell phone, and using all the data that is gathered up in all the different places that I visit to make sure that that is factored into how someone recommends treatment for me.
Yes, and it is now, there's more focus now on outcomes in terms of making sure there's better patient care. So let's talk about the 4 topics for today. We are going to talk about improved patient outcomes. Mustafa, going back to your point around outcomes based, we're going to talk on real-time patient monitoring and how that's possible. Advanced predictive analytics, what is its role in terms of early intervention? And regulatory compliance, because the intricate networks and so many players in the ecosystem. The one topic, as to our attendees too is, as you start thinking about these topics and its relevance, what we've learned is always have KPIs. I think Mustafa, both of you, Mustafa and Colin, have said about outcomes. It's really important to start with, once you have those outcomes, to start with KPIs that are measurable. And if you look at the bottom half of the slide, there's just a, giving you an indication. Have a KPI that's good enough where it's not disrupting, but large enough that it can have a tangible say across scaling solutions. With that said, let's dig deep into improved patient outcomes. One of the ways Calian sees improving patient outcomes is to centralize, bring all the data together. Easier said than done, but obviously it has a lot of benefits that hospitals can use in this particular environment and for the betterment as we move forward. So there's nothing in life without a challenge. And let's look at a challenge, look at the challenges of the CIO. We've touched a little bit on data silos. Mustafa, in your opinion, what's the reality now? How are you seeing a lot of hospitals asking these questions and bringing this to life by looking at different systems, as intricate and complicated as they might be? There's still technology coming in that might be able to solve it.
Yeah, absolutely. I started my career into the healthcare space. I'm showing my age right now, when I was a fresh grad, and the catchword at the time, and this is many years back, it was interoperability. This was the new thing that HL7 was supposed really to sell for. So I would say I'm on the mid of my career, mid-age, gentleman, and I still see that as the future, as the hope. We're going to be interoperable one day. Not to give up yet, but I really feel interoperability as a headline is there to stay after we all pass away, and we will be somewhere else in this life. So I think it's a pain that will continue to evolve. And if anything, really, just objectively thinking, the data sources are never going to get less than where they are today. There are more systems, there are more innovation, there are more commodity of these systems down the path, let alone the internet and the 5G and how fast you can transform data from there on. So I think the problem is only going to get bigger and not really soften and get smaller. The challenge that comes and the opportunity that comes with it, how can we be innovative in terms of the mapping, the translation, unifying that language, unifying these data? And I think the healthcare standard community has come a long way. But it's also, there are multiple standards. There's the FIPA, the HL7, there is the X12 for insurance, there is OMAP for research, and there is DICOM for imaging. And okay, so now we have so we need interoperability of standards, which is actually happening today. You transform and translate HL7 to FHIR and vice versa. And this is probably going to stay for a while, and technology will really have to evolve and catch up. If anything, I think to be realistic about the problem statement, like you said, it's easy said than done, but it can be done. And that's how we drive data, that's how we drive insight. It's a little bit of a hard job to do, but it's doable and people do it. And the more we do it, the more we get better at it.
So there's no magic bullet here. So obviously a lot of work to be done, but it's still very inspiring to get us there for better outcomes. Colin, what have you heard when it comes to interoperability, inefficient patient data? What are you hearing?
Well, it's 2024 and we have not solved interoperability. It is still a topic of discussion. Much like waiting for the Maple Leafs to try and win a Stanley Cup, I'm wondering which is actually going to happen first. Like, are we going to, win a Stanley Cup, or are we going to actually, achieve interoperability? It is such a challenge, right? Because everything is so siloed, and we've heard about the need to be less siloed forever. We all want it, and yet it's not the technology anymore that's holding us back. It is our systems, it is our incentives. There are so many disincentives to sharing data. But thankfully, I think we're making progress on that front now. I think we're finally realizing that sharing data is better. Now, in order to power the AIs of the future, we need to get more data, more comprehensive data that's more representative of patients together. And so now with the power of AI, the allure of AI, added to the list of things that you can do with data that's consolidated, I think now we're starting to get some movement of, okay, you know what, we really do need to start sharing this. We need to figure out a way, beyond HL7 and or maybe with HL7 as its base to finally put all this together. I'm also encouraged by a movement towards more real-time use of the data. I think in the past, this data was very useful, and achieving interoperability was a really great way to look historically at something, and of course for patient care. But now with the movement to real-time and real-time patient monitoring and vitals and all these kinds of things, remote patient monitoring at the home, there's now more of a demand to see the data right now. And I think when you add that real-time element, interoperability takes on a whole new meaning, because it's actually a lot easier in my mind to integrate when it's real-time. But there's only so many data formats that you can send data in real time. And if we can standardize and if we can share that information a lot more freely, which it does have to happen because you have to alert people and do that kind of stuff, my hope is that these drivers of AI in real time will help push the industry faster towards being less siloed and more interoperable.
Yeah, and that excites me. I mean, I like the human angle of hope in it, but I also know that there is data sciences and integration of the data into a single platform that will make it plausible. So let's watch a demo that we developed as part of this, bringing all the data together. And then if there's anything else you want to add after the demo before we go into the next theme. So let's watch it.
Thank you all for joining today. We'll be exploring how Microsoft Fabric addresses critical challenges in the healthcare industry, specifically focusing on data integration, real-time monitoring, and predictive analytics. One of the greatest challenges in healthcare is the fragmentation of patient data across multiple sources, such as lab results, imaging data, and clinical notes. This lack of cohesion makes it difficult for healthcare professionals to derive meaningful insights and make informed decisions. For example, patient data is often unstructured, making it hard to use effectively. Whether it's demographic data from interactions with clinicians or imaging data from CT scans, healthcare professionals struggle to extract useful information from these raw, isolated datasets. As a result, they are unable to get a comprehensive view of the patient's condition, which impacts the quality of care. This is where Microsoft Fabric comes in, providing a centralized data platform that integrates patient data from various sources and presents it in a unified, easy-to-understand manner. Using Fabric's capabilities, we can bring together data from electronic health records, EHR, systems such as Epic or Cerner, along with lab results and radiology images, into a single 360-degree view. Let me show you how this works using a demo. Here's a dashboard built using Microsoft Fabric's Power BI feature. This dashboard pulls data from multiple sources and integrates it into a centralized platform, providing a near real-time, holistic view of patient data. For example, you can see a patient's recent lab results, vital signs, imaging results, and clinical notes, all centralized and updated continuously. Imagine a hospital using Microsoft Fabric to pull data from its various systems and create a unified view of patient information. The dashboard gives healthcare professionals detailed information, such as a patient's demographics, core medical conditions, clinical notes, and historical data, allowing them to track the patient's progress over time. You can also view imaging data, including CT, PET, and X-ray scans, with detailed information on the study and series of images for each patient. Additionally, the DICOM metadata tags have been converted into entities, which healthcare professionals can explore and analyze as needed. This allows for deeper dives into the data, enabling healthcare professionals to slice and dice the data in meaningful ways. Now let's take a look at how this solution works behind the scenes. Microsoft Fabric uses the medallion architecture, which includes 3 layers: bronze, silver, and gold. The bronze layer holds raw data. The silver layer enriches this data with metadata and reference documents, and the gold layer curates and summarizes the data for easy analysis. The healthcare data solutions offering within Microsoft Fabric includes Python notebooks responsible for integrating legacy data into the OMOP platform. When these notebooks are executed, data from legacy sources is transformed from its raw structure into a relational format in the bronze layer. The data is then enriched in the silver layer with metadata and other useful tags. Finally, it's cleaned, summarized, and aggregated in the gold layer, ready for use in dashboards, predictive analytics, and more. This structured, multi-layered approach allows healthcare professionals to access a complete 360-degree view of patient data, integrating EHR, lab, and imaging data into a cohesive system. With this data now consolidated and enhanced, healthcare professionals can make more informed decisions, improve patient outcomes, and optimize care. This concludes Demo 1, and we'll be back soon with Demo 2.
Well, you know, a story comes to my mind. A friend of mine, very recently, his dad had a surgery, and you know, everything went well, and he was sent home. When he went back to the hospital for the stitches, from one department to the other, they weren't aware of the situation and kept asking questions around the surgery and how come he was there. And I think that opens our eyes to something like this. If we had all the data in one place, the angst for the families and the patients would go away. But as we've clearly said, easier said than done. There's lots to be there's lots to be you know, peeled over here to make sure we are talking about solutions. Just to our attendees, you can put in questions in the question answer box. There is a box where you can put in questions that you might have. Moving on to the second topic, from a real-time monitoring point of view, you know, I've seen and read a lot about hospitals that are taking a lead in this, you know, in terms of patient monitoring to track vitals and other critical metrics. But it's not like there's no challenges around it, and some of the challenges that we've discussed. So, you know, when we go a little deeper in terms of these challenges, what we identified, if you move to the next slide, the CIO has all kinds of challenges. The chief medical officer in this case has all kinds of challenges to consider. What are you hearing? I mean, we know this is a critical aspect of better care. What are you hearing, Colin, when it comes to these high costs to implement? And is there like a benefit that's being seen more tangibly? What are you hearing? Colin, I think you're still on mute. I think we'll just wait for Colin to come back, but Mustafa, any thoughts to offer in terms of you know, real-time monitoring and near real-time monitoring?
Yeah, happy to share some of the underpinnings of these challenges, right? The intricacies of these challenges. One example, when you think about the staff training and adoption, when should we venture into that real-time monitoring of patients, then you will be down to the discussion of medical devices or consumer devices that patients have that are integrated with the back system, and that will then, you know, introduce two problems. First problem, the integration itself, how to implement that and the cost of doing this. But then the second problem, the consumerism of that side. There is a device that the patient probably owns or partially owns. Who's going to maintain that device? And when the device doesn't work, who do they call? They can't call their family physician to fix their device Bluetooth connectivity. So who's going to cover that side of the customer support, if you will? So that introduces challenges on both ends, on the IT organization, but also on the clinical organization. Two other, you know, variations I could give you of that problem. Let's say you have a medical device that measures your heart rate. Now,
Right.
if you think about the flow, the fire hose of heart rate data that you will receive from every single patient on every single minute, is that important data? Or the aggregate of that is important? And if the discrete value are important, then you're dealing with the huge data stream that is hitting your IT infrastructure every time and all the time from every single patient. The question becomes, what of it that I really need to keep to make use of and can drive insight from? And what is the aggregation or the sampling that actually makes sense?
Right.
Not least, we are always thinking of the patient from technology we have and the solutions we provide and innovations we do. Once the patient is aware of the fact that he or she are being monitored on a real-time or quasi near real-time basis, they will then have expectation that my healthcare provider is actually watching me all the time. So if I've done anything wrong, they would have just called me. And when you think about the ratio of patient to provider in any country you go, it's impossible to achieve that. So there's an opportunity maybe for AI to nudge and give you some signals. Hey, you're actually deviating from your healthy path, whatever that may be. But again, these are things we have to think about as well. If the patient is really uh, uh, enrolled into that remote patient monitoring, how do you manage their expectation? How you can be realistic about, hey, yes, I'm monitoring in real time, but my reaction, depending on the situation, it may not be real time for obvious reasons, just for human power reasons. So I think these are all areas that keep us all thinking. How can we then take advantage of the technology without driving to misalignment or somewhat of disappointment? Well, I thought you will take care of me 24/7, and that's definitely not the case.
Colin, are you able to come back in?
Can you hear me now?
Perfect. Go for it.
Okay. Yeah, no, I was just going to say, and I know we're running out of time here, but I just want to say that, yes, there is an ROI. And I think the ROI that people are noticing or believing in is that if I'm able to respond to somebody in real time, I can prevent further downstream costs for both the patient and for myself. If I can use these new AI algorithms and these monitoring automations to say, hey, when someone is above or below a threshold, an alarm goes off and I can immediately address it. That can be a big time saving and also lead to better outcomes. And so I think people are starting to see that there is an ROI to this real-time aspect, even though there's a cost to changing the workflows and putting in the infrastructure to do this.
Okay, thank you for that. And let's watch the next demo. It is possible. This is a custom application built by us through Azure and Fabric together. And so let's watch that.
Welcome back, everyone. Today, we'll be demonstrating our second use case, real-time patient data monitoring. One of the major challenges in healthcare is the need to monitor patient vitals in real time, especially in critical care scenarios like the ICU. Healthcare professionals often rely on disconnected systems, making it difficult to monitor important metrics such as blood sugar, temperature, heart rate, and oxygen levels consistently and in real time. Without real-time monitoring, responding to sudden changes in a patient's condition becomes challenging, leading to delays in care. With Microsoft Fabric, we can address this challenge by enabling real-time monitoring of patient vitals using the same sample data set we used in the first demo. Let's imagine a patient being treated in an ICU. In this scenario, their vitals, like blood sugar, temperature, heart rate, and oxygen levels, are continuously monitored by the hospital systems. Microsoft Fabric connects these monitoring systems to real-time event hubs, gathering and displaying the data as you see here. For example, in this graph, you can observe the patient's vitals fluctuating at different intervals, such as every 30 minutes. The system also allows you to customize the time frame for monitoring, ranging from the last 2 minutes to the last 30 days. Here, I've selected a 4-hour time frame, but I'll adjust the frequency to show you the data for the last 2 hours with 15-minute intervals. As you can see, the system visualizes changes in the vitals in real time, and you can set the frequency and time frame according to your needs. This enables hospital staff, clinicians, and physicians to monitor the data in real time. In addition to the real-time monitoring system, Microsoft Fabric provides controls that allow different groups of healthcare professionals, such as doctors and nurses, to access this dashboard. This ensures round-the-clock monitoring of patient vitals by teams working different shifts, enhancing patient care. Now, let's take a closer look at how the system works. Using Microsoft Fabric's real-time monitoring feature, we can set specific triggers for patient vitals. For example, if a patient's heart rate or temperature exceeds a certain threshold, an alert can be automatically triggered. This alert can be sent via email or Microsoft Teams to the medical staff responsible for the patient's care. Let me show you an example. I've configured an alert to send an email when a patient's vitals drop below a certain threshold. Here, we see that a patient, Joe, has had a drop in temperature and oxygen levels, triggering an email notification to the relevant medical team. This alert system ensures that healthcare professionals can take immediate action when necessary, responding to changes in the patient's condition as they occur. By using Microsoft Fabric's real-time monitoring and alerting capabilities, hospitals can ensure that patient vitals are continuously monitored, and doctors and nurses can take immediate, informed action. This system provides a significant improvement in patient care, especially in critical settings like the ICU. This concludes the second demo. Stay tuned for Demo 3, where we'll explore predictive machine learning modeling. Thank you all for joining.
Yes, so it is something that is plausible. This was a custom application that was built by a resident expert, Cybora. We're going to move on to the next topic, which is around predictive analytics. So the predictive models can do a lot of different things. For the purpose of today, we're going to speak about high-risk patients and how to enable early interventions. But as everything else, it comes with its set of challenges. So let's get into those challenges. Mustafa, can you comment on the advancement of data science tools and how might that help in terms of predictability?
Yeah, thank you, Noel. I think when we think about the advancement that happened literally in the last couple of years alone, large language model, Gen AI, Gen BI, and the list goes on. The major cases we really see is, I'd like just to call it for my simplicity, descriptive versus depictive. Descriptive in a case, you could, for example, use LLM today to read through the entire patient record and then generate a one-page summary about that patient. Okay. The beauty of that is the efficiency, but then definitely there is a miss and hit. It's a machine learning model by the end of the day, so you really have to be a little bit aware that there may be some information that were missed from the summary, and how do you adjust to that. Now, the AI world is really evolving to the point where there are cases where the AI model itself, it goes back and it checks, did I miss actually anything, and they could report on their own misses, just for your information. So that's, I think, one area that I would like to call descriptive. You take a free text, you take a large corpus of text, and give me a human readable summary of that. The depictive side, you see that a little bit more into the bioscience, whether it's pathology or radiology or even in genomics, where you start to see patterns at the pixel level that otherwise not visible to the human eye. So an average radiologist, if you look at the image without really zooming to the 50x and 60x level, it would look okay for an average eye. But the algorithms, because they go at the pixel level, they could actually look deeper and depict any patterns that may raise some alarms. Now, yes, the human can also zoom in and get in, but when you zoom in, think about the pixel level. If you have one image of an MRI and you really want to zoom down to the most defined pixel level, the amount of pixels you will have to view is it's going to be very hard for a human eye to do that. So these are the two use cases you will see. I think technology can do things a human probably would not be able to do in a reasonable time. And this is really where the advantage lies. What we need to control for is, of course, the accuracy, and what if there is a miss, how do we control for that?
That's a great point in terms of accuracy, because in healthcare, if there's enough synthetic data that allows for that kind of predictability, those are some of the outcomes that need to be explored as we move forward. What are you hearing, Colin, from hospital executives when it comes to change and adoption? Because predictive analytics is a new, at least an advancement of it is very new to the world.
Yeah, I mean, I think, one day we're going to be ready as a society for, predictive models that are really diagnosing care or really, helping to recommend treatments directly to the end user. I don't think we're there yet. I think there's still a trust gap. And I think part of that trust gap is related to the fact that all of us kind of know intrinsically that the data in healthcare is not unbiased, right? All the research that we've done, all the things that we've done is not inclusive or representative in a lot of cases of the patient population, right? We're missing people who are older, we're missing women, a lot of women in medical research, people of different social and economic backgrounds. So we'll get there eventually. And those things are being improved. But right now, the AI models that we're creating are based on the data we have. And right now, the data we have is not comprehensive. So I think there's an inherent, okay, yes, this is good. It's helping me, but I'm still not going to base 100% of treatment recommendations on these predictive models. Now, having said that, I think where predictive models are being adopted and people are very excited about is when we do get into these early warning predictive models, when I can look at your DNA, I can look at your biomarkers, I can match that and synthesize a massive amount of data that I do have access to say, hey, there's a bit of a chance here that you might have a predilection for an ailment. So maybe we want to do some further testing here. So I'm not saying you have it or don't have it, but I may want to recommend a course of action here to make that determination. So I think that is where people are leaning towards with this technology.
So what I'm hearing from both of you, it's further education, it's outcome-based, examples that will take us in a better direction. So let's watch, how we can support this from a predictive analytics point of view. This particular demo again was with Azure and Fabric together.
Welcome again, everyone. Now I'll be demonstrating use case 3, which focuses on developing predictive models to identify high-risk patients and enable early interventions. One of the main challenges in healthcare is identifying patients who are at high risk of developing severe conditions and intervening early to prevent complications. Without predictive capabilities, hospitals may struggle to allocate resources effectively and provide timely care, leading to increased readmissions and poor patient outcomes. Using Microsoft Fabric's data science and machine learning (ML) capabilities, we can build predictive models that address this challenge. The model is based on historical patient data, using previously confirmed cases of disease as training data and recently captured patient vitals as testing data. This model can predict potential diseases, the severity of the condition, and the next course of action based on patterns it identifies within the data. It also helps hospital staff predict the number of beds needed for patients likely to be admitted, ensuring a smoother inpatient experience. Let's take a look at the predictive dashboard that has been built. On the screen, you'll see a dashboard that highlights individuals who are at risk, including their risk percentage, the predicted disease, and suggested next steps. The model also provides insights on the number of beds required for patients expected to be admitted based on these predictions. For instance, a selected patient has been diagnosed with hypertension, with a predicted risk percentage of 46%. The model indicates that the condition is currently in a normal state, and it suggests the next course of action based on this prediction. Although the model provides recommendations, it is always advised that these predictions and suggested next steps be confirmed by doctors and registered practitioners before being implemented by the patient. This predictive capability helps reduce unnecessary hospital readmissions for non-critical conditions that can be managed with regular precautions and medications. Let's now look at a more critical condition. In this case, the model has predicted a diagnosis of cancer for a patient, which is a high-risk critical disease. The suggested next step is an immediate consultation with a doctor. This allows hospital staff to intervene early and coordinate care with healthcare professionals, ensuring that the patient receives prompt attention before the disease progresses to a more critical stage. By leveraging these capabilities, hospitals can significantly reduce readmissions, ensure timely interventions for critical cases, and optimize resource allocation, including bed availability. To conclude, this predictive model within Microsoft Fabric helps healthcare professionals prevent complications, intervene early, and ultimately deliver better patient care. It aligns with the principle of prevention is better than cure and supports hospitals in implementing proactive care strategies more effectively. With that said, this concludes use case 3. Thank you all for listening, and I'll hand it back to the panel for the remaining topics. Thank you.
Any other thoughts to offer before we move to the last topic? Okay, thank you both. So moving on to what's very close to everyone in terms of HIPAA and PHIPA and the compliance reporting. We know that hackers love healthcare data. There's enough evidence out there. Seemingly, it's one of the top hacking, data they go after. But we also know that automation and AI can help, take some of that headache and that money away. So, Colin, in your mind, is adoption actually at pace, or do you believe that it still needs? It still needs to go to a different level?
And if you ask anybody in cybersecurity, we need to up our game, right? We need to up the funding. We need to up our game here. And I will say that HIPAA and PHIPA are real. These are things, but I think what's encouraging people is that we have a lot of really great data. Now here is where cybersecurity and security data is actually very well understood and is very standardized. And we're starting to see a lot of people talk about adopting technologies that will allow people to monitor their threats and react to the threats in real time, right? Because now with the data, you're able to establish a baseline. This is my normal usage pattern. And if all of a sudden I see a user logging in from a place they've never logged in from before, I can be alerted, or I can segment that and position that very well within my security systems. So I think people are recognizing that this is a really good thing. And good news is, with the data and AI and technology we have available there, people are starting to really make the investments to adopt in this one zone in order to comply with not just cybersecurity, but also HIPAA and PHIPA compliance as well, to make sure that what is being shown and who you are is authenticated, and you are supposed to be looking at this type of data. So this is an area that I think the technology is working very well.
Mustafa, your thoughts in terms of modernizing data protection?
Yeah, I think this is the area I think Microsoft becomes very relevant in that discussion. What Colin mentioned is really the essence, is the cooking, the cooking oil for how you deal with that, right? Being vigilant, being aware. And as we know, the more data you have, the more sophisticated and strong AI models you can build. So there was always this notion, hey, we have a small server, and then we do all the firewalls, so we're really very safe because we're so good. But then be objective. How many signals do you think you can monitor across your own single server, right? You take a step back, you look at the Microsoft global infrastructure. Can you imagine how many signals do the Microsoft security team are observing and training against at the global level? So in some reports, I think I'm looking at one of our security reports from April last year, 43 trillion daily security signals are being monitored by the Microsoft infrastructure globally for all our customers and partners. So when you think about that scale, the intelligence and the knowledge you could build on top of these trillion signals on every single day, that's a huge value for our customers. we are keeping our eyes open, our ears open for you on our platform, within the realm of the possible, of course. But it's always a shared responsibility. So the technology, the cloud aspect is one thing, but there is the organizational, the process aspect. In particular, for example, the incident response and how you orchestrate that. I think we really come to consensus now. It's not about if a breach would happen, it's actually when it happens, because every organization has to have a plan when that happens. I think many years back, it's a very well established practice in the IT infrastructure, something called disaster recovery, which meant, what if an earthquake happened? What if a flooding happened? How do I survive my digital assets if things like that happen? I think now security disasters is part of that. I don't need an earthquake for disaster to happen. I just need a breach, and then I'm pretty much in the recovery mode. So how do you deal with that? Even if you have the best security posture and security threat models, there is always a chance that something may happen on the process side, on the technology side. Because remember, the breach, it doesn't have to be a firewall backdoor someone was it. Maybe someone on the organization shared the password with someone or did something unethical or not following. It could be a human or it could be a technology or anyone in between. So it's really important to think of the vast initiatives and investment that we have done to track those signals globally, acknowledging this is a shared responsibility between the organization and the cloud, but also then, what should we do when it happens? How do we react? What is the protocol? How do we recover? How do we air them?
Those are great points. Make sure we're practicing incident response, to avoid some of those stuff. Ensure that there's security at every level, then you're testing regularly. I think those are some of the things that we talk to clients on a regular basis to ensure that the compliance dashboard is not just a dashboard, that you are actually practicing some of the things that we're suggesting. So what I've heard from both of you is, proactiveness is extremely important as you look at compliance. It's really important to ensure that you know what to do if something did happen. So those are the two things that would be a takeaway for us as we speak to our clients too. As we move on, this particular dashboard allows you to do the compliance of it. And all this comes together through, if we move to the next slide, through Microsoft Fabric, which is an end-to-end unified solution. It will bring analytics together. It will allow predictability. It will store and make it compliant. So it's all-in-one unified solution that is able to do all this in one platform. So I want to just say thank you to the panel for their eloquent views. As part of this webinar, we always say to clients, where do you start? And to us, there's going to be a survey that's going to, as you get out of the webinar, where there are just 3 questions on the topics of interest to you. So if you can please, attendees, take that survey, let us know so we can improvise, get to a better place as we speak to you in the future. We're also offering an in-person data assessment as part of it to our esteemed attendees. And now I open the floor for any questions. Jacqueline, if there are any questions that the panel can take at this point, we may have a minute.
Yeah, thanks to those who are hanging on, Noel. We have a few questions here. The first question I'd like to direct to Mustafa. How different is this solution that we're showcasing today different from what advanced EMR solutions like Epic can offer for reporting?
Yeah, thank you, Jacqueline, for the question. This is often a question we get even internally. Why are we building this? EHR vendors, they have very robust, very industry-specific, out-of-the-box, in the product, in-house reporting capability. So why did we do this? Why are we, reinventing the wheel? Are we jumping into an overly crowded space as a business? And I think the answer is really when if you recall back when we started the discussion today, it's how our data landscape has evolved in the healthcare system as a whole. So the EHR is no longer the only or the largest data source in the healthcare settings. Again, imaging, pathology, even the lab systems are really getting into new spaces right now. So the power of what we really bring is really to complement and not to overcrowd. EHR are welcome to the data platform, but also all the other data sources are welcome. And this is not something an EHR system will be intrigued about or focused on. It's really beyond the realm of an EHR. So if the use case you have is really you are a small organization, you have one EHR, and all you need to do just to report on that EHR, I think you're fine where you are. But if you want to really have that 360 purview of the entire data estate, the entire patient journey in the organization, outside the organization, with remote monitoring, with other modality, that's where we become super relevant to that discussion.
Well, thank you for that, Mustafa. I think we are on time here. We're about 2 minutes. I want to thank all the attendees for still hanging around. We will still take a look at the questions and be able to answer them in a different format. Also, I want to let people know if there were any additional questions, please feel free to email it to us. So thank you, panel. Thank you, attendees. And I hope everyone has a good afternoon.
Thank you.
Take care.
Bye.